I think that's reasonable. But I let them get back to work as soon as they want to get back to work. And everybody has a different situation. They say, I want to get back to work. You're not doing any harm by getting them back to work in terms of their sensitivity. It's more of a symptomatic issue. Does that answer the question?
Yes.
Yeah. Let's talk about carpal tunnel syndrome, something that I think probably many people know a lot about. Hopefully I can give my opinions about this and give you some of the data and hopefully bring up some discussion regarding this. How are we doing time-wise? Great. All right, carpal tunnel syndrome, which I'll abbreviate CTS here. Epidemiology of carpal tunnel syndrome. It affects lots of people. That's what you need to know. But 50 cases per 1,000 person. That's about 1 in 20, 5% of the population. It's a big deal. Certainly people in this room have it. I'm beginning to get symptoms of it occasionally. It's a very important problem. It's about 3.8 million visits per year, which is a lot of visits. 500,000 surgeries. $30,000 per patient. You say, how can it cost that much? But between visits, surgery, injections, it adds up. And we're talking about $2 billion annually. So let's compare fingertip injuries. It's about $750 million. And acute ER visits, this is $2 billion annually. So it's a big deal. So it's very important, certainly in the occupational health world. What is the anatomy? So let's just talk about it. Carpal tunnel, it's actually a tunnel. And the tunnel, the top of the tunnel is called the transverse carpal ligament, the flexor retinaculum. I have another picture, but just if you can see this, this is the tunnel right here. This area right here is the flexor retinaculum, the transverse carpal ligament. Why is it called the flexor retinaculum? Well, within here, these 9 tendons are flexor tendons, what flex our fingers. So in the tunnel are tendons, 9 tendons, and the median nerve. Now, the median nerve is what causes carpal tunnel syndrome when it gets compressed. 9 tendons, the median nerves. Posteriorly, or the back of the tunnel, are the bones, the carpal bones that I showed you an x-ray of before. Ulnarly is a bone called the hamate, which sticks up right here. Radially is the trapezium, or the base of the thumb. And this is another picture. This is taken from the Journal of American Orthopedic Society by Cranford in 2007. It's a good picture. This is the tunnel. These are the 8 tendons plus one more tendon called the FPL, which goes to the thumb. And this is the median nerve right here. So what is the pathology or pathophysiology? We don't know. I'll get to that in a moment. But the gist of it is the tunnel gets smaller and pressure is put on this nerve. Usually, just anecdotally, and some data supports this, it's a thickening of that flexor retinaculum, but we'll talk about that. What does the nerve look like and what's the etiology? This is actually I do a lot of microsurgery. When the nerve is cut, unfortunately, with a laceration, this is what the nerve looks like on end. This is about 1.5 centimeters across, 2 centimeters, and these are fascicles. It's just like an electric cable that carries electricity, and that's what it looks like, and there's a lot of vascularity.